Okay, so next is getting blood to and from the arm, forearm, all the way down to the digits. So, not very hard. Most of, especially the arterial flow, is totally reasonable and makes sense. So, let's just go ahead and go through it. Blow this up for you. Okay, so it's pretty easy. So, we're going to start right here. So do you remember how we got here, since this is on the right side? So I'm in the subclavian artery now, but how did I get there? I got there through the aortic arch, and then over to the right side, I would get there by going aortic arch to brachiocephalic artery or trunk. And then from the brachiocephalic artery or trunk, it would split into the right common carotid, which we already did because it did the head, and then the right subclavian. So now that I'm in the subclavian, I'm going to be subclavian as I go under the clavicle, hence the name. And as I go through the armpit, I'm going to be called the axillary, right? As I go through the arm region, I'm going to be called the brachial. Pretty reasonable, right? And then you can go one of two ways after you've gone down the brachial. You can either go down the lateral side, and then you're the radial artery, or you can go down the medial side, and you're the ulnar artery. And then once you get down to the wrist area, there are two arches. These are actually anastomoses that we talked about before. There's the superficial palmar arch, which is anterior, and the deep palmar arch, which is posterior. And then that gives rise to all of these, which are not surprisingly called the digital arteries. Pretty damn easy, right? Okay, there's a couple other arteries in there that are not on your list. So we got blood all the way to all of the portions of the arm, and now what we need to do is we need to get it back. So deliver it to the capillary beds, drop off the oxygen, and pick up carbon dioxide, and then start going back. And as we start going back, we've got a couple of different choices. We can either do superficial drainage, in which we are going to be in the superficial veins, or we can do deep drainage. Remember that there are way more superficial veins than there are deep veins. Okay, so if you are going to do superficial drainage, you are generally going to start, it's very difficult to see on these figures, so I recommend that you look at them in your textbook, but I'm going to show you. On this side, the two different colors of vessels are important. The superficial veins are lighter blue. They are not in a human. And the deep veins are represented as darker blue. In this picture also, although it's really hard to see, the superficial veins are on the dorsal surface of the hand. So on the back side there. So, but it's not hard to see on your own hand. If you hold your hands out, especially if you hold your hands down for a couple minutes before you do this, then look, you will see that there's quite a few superficial veins on the dorsal surface of your hand. So we're going to do those first. So we would follow up from those digital veins, some of which will go into deep drainage, most of them. There's a couple that are a little bit superficial, but then you've got that superficial palmar, what do they call it? The dorsal venous network. Dorsal venous network on the superficial surface of the dorsal side. And then what's going to happen with that one is it's going to go up sort of the back side of your arm and then dump into either the cephalic vein or this one, which is called the basilic vein. There's lots of variation about where those things branch and pretty much everywhere. And then there is one or more anastomoses between the basilic and the cephalic vein. Here's a really common way that it could look, right? Which this one right here, which is called the median cubital vein. The median cubital vein runs right across the anterior surface of your elbow. It's pretty superficial. It's really commonly used as a site of blood draw. But that's not the only way that it exists. As a matter of fact, we have a model in lab, which we call the wireman. And the wireman has a different way of doing it. It actually has two vessels, and one of them is the median basilic, and one is the median cephalic, and they actually join. But regardless, It's fine if you learn it the way that it's in your textbook. It's just not that way in every person. So if you go into healthcare, don't expect it to be that way in every person. Okay, so now where do I go? Where I go now is I'm going to finish with superficial drainage by the basilic vein will continue up, and it kind of dumps wherever the heck it wants. The most common places for it to dump or either it dumps into the brachial vein or veins, or sometimes it dumps all the way up into the axillary. So you find it because it's superficial and on the medial side. Or the other route that superficial blood could take is up the cephalic vein. And the cephalic vein is called cephalic because it's headed toward the head, not because it's in the head. That's the cephalic vein. And again, that one dumps pretty much where it wants as well. Usually dumps a little higher, maybe not, but it dumps either into the brachial or into the subclavian, or it can even do the axillary if it wants to. So it's really variable where it dumps. So how do you know what it is? You know what it is because it is a superficial and lateral vessel on the arm. Okay, so that's the superficial drainage. So eventually, wherever you dump that blood, it's going to end up in the subclavian vein, right? And then remember that the subclavian veins will gather up all that blood from the arm. I'll pick up the rest of it in just a second. Add in the blood in the head. And then it is going to, after you've got arm blood and head blood, then you become the brachiocephalic vein, which you can see just a little bit of right here. Right here. That's a little bit of the brachiocephalic vein. The two brachiocephalic veins will unite to form the superior vena cava, which will dump back into the right atrium. Cool? Okay, but we have more drainage to do because we also have deep drainage in the arm and the forearm and the digits. Okay, so let's figure out how that goes. So if I wasn't doing superficial blood flow, like to the skin, for instance, but deep blood flow, like to the muscles all the way in, the fingers and the muscles running in the arm and the forearm, how would that go? Well, that goes digital veins, doop, 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 to some arches. You can kind of see them here. They're the superficial and deep palmar arches. To me, it's really hard to tell which one is in which position, so just call them palmar arches and you'll be good. And then what I want to show you is it is going to take that deep blood up from these palmar arches and either end up in a pair of ulnar veins or a pair of radial veins. How do I recognize those? Those are deep, and the radial ones are lateral, and the ulnar ones are medial. Okay, so you can see this arch leading up to the medial ones, or to the inside one of each one. Okay, and then when does it turn into the brachial veins? After it goes over the elbow, and it's in the brachial region, it's brachial veins. Usually two, sometimes it's one right after the elbow. Sometimes it stays two for a while. Sometimes it stays two all the way up because veins are very variable. Why is it? So how do you know it's the brachial veins? It's deep and it's in the arm. Okay. And then it's still brachial. Oops, that's not what I meant to do. It's still brachial. Okay. Till it gets into the armpit, and then it is axillary, goes under the clavicle, then it's subclavian, and then the same story we just told a second ago, which is gather up all of the blood from the arm, check, gather up the blood from the head, primarily from the internal, external jugular veins and the vertebral veins, and then again you are in the brachiocephalic veins. There are brachiocephalic veins on both sides, even though there's only one brachiocephalic artery. There are brachiocephalic veins on both sides, and then those dump together to make the superior vena cava. And that is blood supply to and from the arm. Okay, so now when you're doing trace on that one, all that's important or hard is that you have to pay attention to whether they're asking you for superficial drainage or deep drainage. Okay, so